For the past few years, the pharmaceutical world has been completely revolutionized by the meteoric rise of GLP-1 receptor agonists. Celebrated globally for their unprecedented ability to treat type 2 diabetes and obesity, medications like semaglutide and tirzepatide have fundamentally altered modern metabolic medicine. Yet, as these drugs flooded the market, intense regulatory anxiety followed closely behind, with public health agencies heavily monitoring early, conflicting reports regarding potential psychiatric side effects, like sudden mood drops or increased anxiety. But according to a monumental genetic breakthrough featured by newsmedical.net, the ultimate verdict on these medications is shifting dramatically. High-level genetic data reveals that activation of the GLP-1 receptor isn't just psychiatrically safe. It is actively, profoundly linked to significantly lower odds of developing major depressive disorder and bipolar disorder. To uncover these long-term neurological impacts, international researchers utilized a sophisticated methodology known as drug-target Mendelian randomization. By studying large-scale genomic datasets from global biobanks like FinnGen, scientists modeled the lifelong biological effects of natural variations in the GLP-1R gene. The statistical results are sending shockwaves through the psychiatric community. The study revealed that a genetically predicted activation of the GLP-1 receptor, which correlates with a lower body mass index, corresponds to a highly impressive 18% lower odds of major depressive disorder. Even more staggering was the protective effect against bipolar disorder, which saw a massive 39% reduction in overall risk. Furthermore, the genetic models tracked a broad, consistent improvement across the global well-being spectrum, signaling higher life satisfaction, greater positive effect, and a sharp reduction in neuroticism. What makes this research an absolute game-changer is that these mental health benefits are not just a surface-level byproduct of shedding physical weight. While weight loss certainly plays a massive role in reducing systemic bodily inflammation and boosting self-esteem, the genetic data demonstrated that GLP-1 receptor activation alters the central nervous system in ways that go far beyond basic body mass metrics. The human brain is incredibly rich in GLP-1 receptors, particularly in the hypothalamus, the hindbrain, and key dopaminergic reward pathways. Neuropsychiatrists point out that conditions like bipolar disorder involve severe cellular energy deficits and a profound dysregulation of neural reward processing. Activation of the GLP-1 receptor steps in as a metabolic circuit breaker, enhancing mitochondrial efficiency, activating antioxidant pathways that shield neurons from oxidative damage, and stabilizing the very neural networks responsible for emotional regulation. Ultimately, this genetic milestone completely reimagines the future relationship between metabolic care and psychiatric healing. By proving a protective causal link between GLP-1 pathway activation and severe mood stabilization, the study provides a powerful genetic green light to aggressively explore repurposing these metabolic medications for primary mental health treatment. While experts caution that clinical trials remain essential to fully map out short-term therapeutic dosing, this data bridges the artificial gap we have long placed between the body and the mind. It reminds us that physical metabolic health and mental wellness are entirely inseparable. By leaning into these integrated biological pathways, we can move past temporary, isolated psychiatric treatments and build a holistic foundation for lasting neurological resilience, emotional sobriety, and deep peace of mind. This vital medical advisory was originally detailed by newsmedical.net, and you can explore the complete genomic datasets and peer-reviewed methodology by checking out the links in our show notes.